Welcome to the Canadian Digestive Health Foundation Trending Now Digestive Health Discussions on food, gut, brain, and liver, the full picture of MASLD. This event has been made possible by a grant by Novo Nordisk. And I'm Keren Reiser, a registered dietitian in Ottawa, Ontario. I focus on helping individuals manage complex digestive health conditions through nutrition, education, and personalized care. The disclosures are such that I am being paid by the Canadian Digestive Health Foundation for this presentation. Before we dive into the presentation, I want to give you a quick overview of what you can expect to take away from today's session. By the end of our time together, you'll be able to, 1, understand what MASLD is, how it differs from other liver conditions, and how it's diagnosed. 2, recognize how MASLD affects different people. 3, compare lean and obese MASLD. 4, understand the brain's role in eating. 5, explain the gut microbiome connection. And 6, know what foods help or harm the liver. So I will be focusing on key dietary strategies, including how fiber, probiotics, and balanced meals can reduce liver fat and inflammation. Let's start by understanding how fatty liver disease has changed, not just how it affects the body, but also how we call it. On the left side of this diagram, you see NAFLD, which stands for non-alcoholic fatty liver disease. This name was used for years to describe fat buildup in the liver that wasn't caused by excess alcohol intake. The problem was that it didn't explain why the fat was there, just that it wasn't related to excess alcohol consumption. It was diagnosed by ruling things out. Now look at the right side. We have a new name, MASLD, MASLD, Metabolic Dysfunction Associated Steatotic Liver Disease. Steatotic just means fatty. This name tells us more. The fat buildup in the liver is linked to metabolic problems like being overweight, high blood sugar, high cholesterol, high blood pressure. The red words in the center of the diagram say insulin resistance, which means the body has trouble using insulin properly, a key cause of fat building up in the liver. The black arrows show how these metabolic problems lead to more inflammation, blood sugar problems, and something called oxidative stress, marked here as ROS, which is like the body being under chemical stress. All of this leads to something called metabolic dysregulation, when the body's systems aren't working smoothly anymore. The boxes at the bottom of the diagram explain why this new name, MASLD, is helpful. It's based on positive findings, not just ruling out things. It helps doctors find better treatment, and it makes research more focused by reducing confusion across different cases. In short, the change from NAFLD to MASLD helps us better understand what's really happening in the body and what to do about it. MASLD is a silent epidemic, and it's very common. About 1 in 4 Canadian adults have MASLD. That's around 8 million people. And it's getting worse. By 2030, it's estimated that this number could grow to over 9 million. It's often missed because many people don't know they have it until it's serious. And it can be dangerous because MASLD can progress into liver scarring, liver failure, and even cancer if not caught early. Healthcare costs will grow into the billions, and lifestyle costs will grow as well. Why does MASLD awareness matter? Well, let's start with knowing the risk factors many people live with every day: diabetes, obesity, and high blood pressure. These conditions can put strain on the liver even if you feel fine. Fat buildup in the liver, MASLD. In simple terms, fat is accumulating in your liver without alcohol playing a role. It is often silent, meaning there could be no symptoms to alert you to make health changes. And without changes, this can progress to inflammation, shown in the next box as MASH. MASH stands for Metabolic Dysfunction Associated Steatohepatitis. This is when the liver becomes irritated and damaged and it starts to struggle. If nothing is done, the damage can get worse. And that's the final red box, fibrosis, liver tissue scarring, which then leads to cirrhosis, the liver not functioning properly, and then liver cancer. But if you look at the blue path on the right, with healthy lifestyle changes, like losing 7 to 10% of your body weight, or even just 3 to 5% for lean individuals, eating better and moving more, the liver can heal. MASLD can be reversed, especially if caught early. Liver damage from MASLD is most reversible in early stages, fibrosis stages 1 and 2. With healthy lifestyle changes and sometimes medication, many people can see big improvements. Once the disease progresses to the later stages, stages 3 and 4, it becomes much harder to reverse the damage. At that point, the goal is to prevent complications, to slow down the disease and manage symptoms. That's why catching it early is critical. Why is this reddish-brown organ located in the upper right part of your body or abdomen important? Because your liver is one of the hardest working organs in your body, kind of like a built-in filter and factory all in one. Here are some of its most important jobs. It cleans your blood by removing toxins, chemicals, and drugs. It stores energy in the form of sugar, so you have fuel between meals. It breaks down fats with the help of a yellowish fluid called bile. It helps digest food, especially fats and fat-soluble vitamins like A, D, E, and K. It makes important proteins that your blood needs to clot and your body needs to stay balanced. And it supports your immune system by helping fight off infections. Now, imagine what happens when fat builds up in the liver and it can't do all these things properly. That's when trouble starts. A tired, fatty liver can't filter blood as well, can't control blood sugar properly, and might even become scarred or inflamed over time. A healthy liver means a stronger, cleaner, better working body. As mentioned earlier, liver disease can often develop silently, with symptoms only appearing after significant damage has occurred. Some common early signs include fatigue and weakness, so unexplained tiredness that persists despite adequate rest, abdominal discomfort, so pain or tenderness in the upper right side of the abdomen, appetite changes, reduced interest in food or unintentional weight loss, sleep disturbances like irregular sleep patterns that affect daily functioning. All these are kind of vague, they're non-specific symptoms, making it easier for liver disease to go undetected in the early stages. So early intervention is crucial. MASLD screening is important because some people have a higher risk of developing serious liver problems like fibrosis, and we need to keep a close eye on them. So the first group at the highest risk is people living with type 2 diabetes. Their chances of developing liver scarring are much greater, so they should be prioritized for screening. Other high-risk groups include people with or living with cardiometabolic conditions like obesity, high cholesterol or high triglycerides, or dyslipidemia, high blood pressure, or hypertension. These conditions often go hand in hand with MASLD, even if the person has no symptoms of liver failure. Luckily, there's a simple way to screen for liver scarring using a tool called the FIB-4 score. It uses common blood test results like liver enzymes, age, and platelet counts to estimate the risk of fibrosis. It's easy for primary care doctors to use, and it doesn't require special equipment. So finally, if fat is found in the liver by accident during like an imaging test, like an abdominal ultrasound or a CT scan, or for whatever reason you're having some imaging, that shouldn't be ignored. It's a signal to follow up and check for MASLD before it progresses. So moving on to the second objective of our presentation, how MASLD affects different people. So let's learn about more about MASLD and what's going on. So not everyone experiences MASLD the same way, and understanding these key differences is important for better care. Hispanic communities have the highest rates of MASLD, while African American individuals tend to have lower rates, but face more severe outcomes when it does occur. Diet plays a huge role. Eating a lot of saturated fats, added sugars, and processed foods can speed up liver damage, while on the other hand, a Mediterranean-style diet can help reduce fat in the liver. Up to 1 in 3 people with MASLD have sarcopenia, which means a loss of muscle mass and strength. So this makes the disease progress faster and affect the quality of life. All of this shows that one size does not fit all for MASLD treatment. The best care is personalized based on a person's genes, food environment, body type, and even social factors like access to healthy food and medical care. Earlier in the presentation, we talked about how people with type 2 diabetes are at the highest risk for MASLD. In fact, studies show that about 1 in 2 people with type 2 diabetes also have MASLD, a much higher rate than in the general population. This sharp rise tells us that type 2 diabetes is one of the most important risk factors for developing liver disease, but it works both ways. People with MASLD are also more likely to develop type 2 diabetes. So the two conditions are closely linked and they fuel each other in a cycle. The reason? Insulin resistance is the major connection between them. It causes the liver to make and store more fat, which contributes to liver damage. Other factors add to the problem. Inflammation driven by signals called cytokines harm the liver cells. Visceral fat, so fat accumulating around the belly, produces oxidative stress or stress that damages the liver, and changes in the gut microbiome, the community of bacteria in our intestines, that can increase fat absorption and trigger inflammation. The role of diet is crucial in managing MASLD. Poor nutrition patterns can trigger inflammation and worsen MASLD, potentially leading to more serious complications like MASH. Processed foods accelerate liver fat accumulation and inflammation. Added sugars, especially fructose, promote hepatic or fatty liver. Saturated fats increase the stress in the liver cells, and systemic inflammation drives the progression from just fatty liver to inflammation and then to the hardening of the cells. Healthy muscles play an important role in MASLD protection. So when people lose muscle strength and size, a condition called sarcopenia, it can make their metabolism worse. It raises blood sugar levels and increases the body's inflammation. So about 1 in 3 people with MASLD have sarcopenia, which is linked to a more serious disease and long-term health problems. People living with MASLD often have weaker muscles, poor fitness, and more fat in the liver, and have higher bad cholesterol, and may even feel more depressed. So we're going to talk also about the brain. So doing strength-building exercises and eating more protein can help protect the muscles, improve metabolism, and slow down liver damage. This shows how the muscles and liver health are closely connected. MASLD doesn't look the same for everyone. That's why personalized treatment is so important. People living with MASLD will develop it for different reasons and progress at different speeds. So we need to tailor treatment to the individual, not take a one-size-fits-all approach. Genetic screening can help identify those at a higher risk gene type who need closer monitoring and early intervention. When it comes to nutrition, personalized nutrition plans, taking into account cultural preferences, metabolic needs. Exercise, finding an exercise program or fitness level and lifestyle that fits the person. We also want to focus screening efforts on people living with type 2 diabetes, obesity, or elevated liver enzymes. And finally, we can't ignore social factors. So people who don't have access to healthy foods, safe spaces for physical activity, and affordable health care all make a big difference addressing how we deal with MASLD and reverse it or prevent it. Moving on to our third objective of the presentation, understanding the differences between lean and obese MASLD. MASLD can look different depending on your body size. So not all people with MASLD are overweight or obese. There is a proportion of lean people who can still have fatty liver. That's often because of genetic factors or hidden problems with how their body uses insulin. On the other hand, people living with obesity usually get MASLD because of too much calorie intake or how fast their fat tissue is working in their body. So, what's tricky is that lean people often don't show many warning signs. Their liver enzymes would still look totally normal. And in fact, 80% of people with MASLD have normal enzyme levels or liver enzyme levels. So even 15% of people with serious liver scarring might not show anything unusual in a blood test. This slide helps us understand how treatment strategies differ between people who have lean MASLD and those who have obese MASLD. Let's start with the primary goal. For lean MASLD, the focus is not on weight loss, but on improving metabolic health, things like insulin sensitivity, cholesterol, and blood sugar in their diets. But for obese MASLD, weight loss is key. Ideally, 7 to 10% of body weight loss will help improve liver fat and inflammation. And then what about diet? So in lean MASLD, we don't prioritize on calorie cutting unless the person is overeating. Instead, the goal is to improve the quality of the diet. Focus on nutrient-dense foods and foods that support blood sugar control. For obese MASLD, caloric restrictions is central. The focus is on eating fewer calories, but also changing the macronutrient distribution and reducing added sugars or saturated fat. Physical activity is important for both, but the role is slightly different. In lean MASLD, exercise improves metabolism and insulin sensitivity. In obese MASLD, it's critical not just for weight loss, but also to keep it off and support long-term liver health. Surgical and medical options also are different. Weight loss surgery is not recommended for lean MASLD, but with morbid obesity or obesity, surgery may be considered to help with weight loss and improve liver outcomes. As for medications, both groups may benefit from drugs that target metabolic dysfunction. Finally, screening for lean patients, it's important to rule out other causes of liver disease like alcohol, medications, or infections. For obese patients, screening focuses on how severe the liver fat inflammation is and what other risks might be present. In summary, both lean and obese MASLD need attention, but the approach is a little different and tailored. Whereas lean MASLD will focus on optimizing metabolism at the beginning, obese MASLD will focus on weight reduction and metabolic repair. Now let's look at how the brain is affected with MASLDs and what's going on. So in MASLD, the brain's reward system doesn't quite work the way it should. Normally, when we eat, our brains release dopamine, a chemical that helps us feel satisfied. But with MASLD, that response is blunted, meaning people don't feel as full or satisfied after eating. And as a result, they might keep eating even if they've had enough. On top of that, the liver-brain connection gets disrupted. The liver sends out inflammation signals that mess with hunger hormones and nerve communication. So the brain starts receiving mixed messages. You're hungry even if you're not hungry, or you feel full even after having a proper meal. A big part of this problem is insulin resistance, which is common in people living with MASLD. Insulin normally helps regulate hunger and blood sugar, but when the body stops responding to it properly, it can lead to stronger food cravings and more fat storage in the liver. The gut microbiome, the bacteria in your digestive system, also plays a role here, where there's an imbalance known as dysbiosis. It can make cravings for unhealthy foods even stronger and reduce satiety signals so you don't feel full. So what does this really mean in real life? People living with MASLD are more likely to feel hungry after meals, crave high-calorie, ultra-processed foods, eat more than they actually need. And not all of this is about willpower. These are biological changes that make it harder to control eating, maintain a healthy weight, and protect the liver. That's why treating MASLD isn't just about telling people to eat better, it's about understanding what's going on in the body and building supports around it. To further complicate things, the growth of convenience foods. Ultra-processed foods are engineered to have the perfect blend of sugar, salt, and fat to create a bliss point, the combination that is most rewarding and addictive to our brains. These foods are designed with flavor enhancers, texture modifiers to make them as appealing and pleasurable as possible to our senses. Eating ultra-processed foods causes rapid spikes in blood sugar and dopamine release, creating this neurochemical roller coaster that's driving cravings and overconsumption. The formulation of ultra-processed foods is scientifically designed to maximize this dopamine response, creating supernormal stimuli that are far more intense than anything we encounter in nature or from regular food. So all this creates a powerful feedback loop, making people reach for more ultra-processed foods even when they're not hungry. And over time, the brain becomes less sensitive to natural rewards, which may reduce interest in healthier food options. This imbalance between overstimulation from processed foods and under-response from natural foods can make healthy eating feel less satisfying. In contrast, whole, unprocessed foods maintain a more steady, stable dopamine response without significant effect on the dopamine receptors. Moving on to Objective 5, the gut microbiome, which is the community of trillions of tiny good bacteria, viruses, and fungi that live in your digestive system. These microbes help digest your food, make vitamins, train your immune system, and protect your body from harmful germs. One of the most exciting breakthroughs in health today is the powerful connection between your gut, your brain, and your liver. Inside your gut, as I mentioned, are trillions. I mean, I don't even think there's a complete number of how many microbes. So the microbes, the gut microbiome, influence how you feel, how motivated you are, and even how clearly you think. Some of the gut bacteria help make dopamine, your brain's feel-good chemical, which is what gives you a boost when you eat something delicious, finish a task, or accomplish a goal. So dopamine is responsible for supporting motivation, focus, and energy. But when your dopamine's low, you might feel foggy, tired, or lose interest in the things that you normally enjoy. And then here's what I find very fascinating. When you eat a diet that's higher in fiber, fiber is a prebiotic that your gut bacteria, which I like to call the probiotics, as they're called, ferment. So prebiotics and probiotics ferment in the gut. And in that process, they produce what we call short chain fatty acids. So in the next slide, you'll see SCFA for short chain fatty acids. I like to use the garden analogy to explain how fiber works in your body. So imagine your gut as a beautiful garden. Watering your garden, when you eat fiber, which is prebiotics, especially from foods like fruits, vegetables, beans, and whole grains, you're basically watering your garden. The fiber is feeding, so it's providing the food for the good bacteria, the probiotics in your gut. In return, when they're together, the bacteria will now break down and create those short chain fatty acids, postbiotics. They strengthen your gut lining, they calm inflammation, and support your metabolism. They even help your brain use the dopamine and serotonin more effectively. So when your gut is thriving, your whole body, the home around that garden, becomes a better place to live. You feel calmer, you feel more energized and more in control. And really, it's as simple as eating fiber, as watering your garden. The fiber and the probiotics, the good gut bacteria that's naturally in your gut. It doesn't come from a pill. It's naturally there already. Create the short chain fatty acids, the flowers that'll protect and nourish you. And a happy gut becomes a happy home for your brain and body to live in. The question I get asked all the time when I make this explanation is, if short chain fatty acids are so good, can I just take them in a pill, just like we take probiotics? And the short answer is not quite, at least not yet effectively. So breaking it down, the SCFAs, short chain fatty acids, are powerful compounds, and they play a big role in the gut, the liver, and the brain metabolism. So we don't get a lot of short chain fatty acids directly from food. So we do get some from fermented foods, and that's why there's often the recommendation to have some more fermented foods. But also, as I showed you in the previous slide, your body makes those SCFAs internally. And the best way to do that is by providing the right types of fiber, natural foods, which are natural prebiotics. There are some short chain fatty acid supplements out there, or ingredients put in supplements called sodium butyrate, and they may be labeled as postbiotics. There are some early studies showing promising results in metabolic health and for people living with MASLD, and it appears to be very safe so far. But the research is still in the early stages. We don't yet have large long-term studies proving that these supplements work better than what your body can naturally produce. So my advice is you feed your gut and your gut feeds your liver. Objective 6, knowing what foods help or harm your liver. The Mediterranean diet has some of the strongest evidence for helping reverse MASLD. If you're overweight or even if you're lean, the Mediterranean diet is the key diet. The Mediterranean diet focuses on whole, minimally processed foods, lots of vegetables and fruit, so those prebiotic fibers, whole grains, nuts, and seeds, and healthy fats like extra virgin olive oil. It's a simple, enjoyable way of eating that supports your liver, heart, and overall health. I want to be clear on this slide. I don't like labeling foods as strictly good or bad. And I know you're seeing the green and the red list. So the green list shows foods to prioritize more often, like fiber-rich plants, healthy fats, lean proteins. These are foods that help lower inflammation, support gut health, and protect your liver. The red list is not a no list, but an enjoy less often list. Not because they're forbidden, but because having them too frequently can contribute to liver stress over time, especially when it comes to added sugars, saturated fats, and alcohol. We've talked a little bit about fiber, but I want to go into a closer look at the types of fiber that are important in your diet. So there are two main types of fiber called soluble fiber and insoluble fiber. When we look at labels, and we're going to look at them soon, we get a number of total fiber in a food. But it is important to understand the distinction between soluble and insoluble fiber. Soluble fiber dissolves in water and forms a gel-like substance in your gut. It helps slow down digestion and sugar absorption, lower cholesterol, and feed your beneficial gut bacteria. Supports dopamine and reduces inflammation, and it's found in foods like oats, barley, legumes, apples, and citrus fruits. Insoluble fiber does not dissolve in water. So I call insoluble fiber the fiber that you see with your naked eye, the fiber that you're thinking of when you're looking at a vegetable. That is what we call roughage. Maybe it adds bulk to your stool, and it helps also keep your bowels regular, prevent constipation, supports healthy gut lining, and it's found in whole grains, nuts, seeds, and vegetable skins. When it comes to liver health, we need both types of these fibers. They're important to reduce fat buildup in the liver, improve the insulin sensitivity, lower inflammation, and support healthy weight management. The goal for total dietary fiber is from anywhere from 25 to 38 grams of fiber per day. And we want to see a mixture of both. When in my practice, when I'm doing diet reviews, I often notice that people are not consuming enough soluble fiber, which is why I tend to spend a little bit more time talking about it. So how do you boost soluble fiber? You can, one, add seeds like sprinkling chia, flax, or hemp seeds into your breakfast or smoothies. Two, add beans and legumes. Just 1 to 2 tablespoons per day can go a long way. They are packed with soluble fiber and nutrients that your body needs. You can add fruits into your snack, eating the flesh, keeping apples, pears, citrus fruits handy. Vegetable preps, having, vegetables as much as possible. Supplement smartly. So sometimes some people need to supplement their soluble fiber in their diet because of, maybe some of these foods that I've listed above are a little bit more discomforting to some people. So that's where you may have to add in some more oats or psyllium husk to improve your intake of soluble fiber. One thing that's very, very important, you have to remember to gradually increase your fiber intake and stay hydrated and optimize it with the soluble fiber slowly. Because as we showed, or as I said in the previous slides, fiber is the prebiotic. It is the food for the probiotic, the good bacteria in your stomach that produce the postbiotic, the short chain fatty acids, through fermentation. If you suddenly go from not having a lot of fiber to adding in a lot of fiber into your diet, you can end up with hyperfermentation, a lot of fermentation at once, and your body's not really ready for it. So if you gradually introduce these fibers and start boosting your microbiome with the prebiotics, you will feel less gastrointestinal symptoms, or and bloating and gas and maybe constipation or diarrhea. So next, I like to cover how to read a nutrition facts label, because it's important to understand how to know about the quality of the food that you're going to choose to consume. So there are 3 steps. The first step is to start with the serving size. This will tell you the exact amount the nutrition facts is related to. So it's important to check first that it's how much of the food that you're planning to consume. So then the next thing is to forget about the calories at first. Go look at the percentage daily value on the right-hand side. And you'll see at the bottom of the nutrition facts, there's a footnote that says 5% daily value or less is low in that nutrient, and 15% or more of the daily value is high. So with liver health, you want to choose foods that are lower in saturated fat, added sugars, and sodium. So I call those the 3 S's. So you want the 3 S's to have a lower number, and you want the F, fiber, to be higher. The third step is to review the ingredient list. Ingredients are listed from most, the largest volume in that recipe to the least. So you can quickly see if your food is heavy in sugar or salt or fat based on the ingredient list. So hopefully the next time you look at a label, I want you to look at it and go beyond the calories and look at the percentage daily value and use that to compare 2 similar products and make the choice that's best for you. The next thing that people ask me about is intermittent fasting. So I like to explain, intermittent fasting is really setting planned times for when you eat and when you won't eat. So it's not about what you eat, it's about when you eat. So it's a time factor of eating. So the research has shown that intermittent fasting can benefit liver health by reducing fat buildup in the liver, lowering liver stiffness, decreasing certain liver enzymes linked to inflammation, and some patterns show promise for weight loss. So there are different patterns of intermittent fasting. I've heard of some that are 16 hours of fasting with 8 hours of eating. I've seen 12 hours of fasting and 12 hours of eating. The pattern that's showing the most promise with liver disease is the 5-2 method, where you eat normally for 5 days, followed by a lower calorie plan, like lower calories on 2 non-consecutive days. So how you can do this is 3 days of regular eating, followed by 1 day of lower calorie eating, and then repeat that pattern again. So that has shown in the research to improve weight loss, lower inflammation, improve insulin sensitivity, especially with MASLD. But it's important to know it's not for everyone. So if you have diabetes, you're on medication, um, you know, you need to think about how the medication and your food is interacting and the timing. If you have a history of disordered eating or an eating disorder, this would not be a really healthy way of approaching it. So the most important thing is to really think about yourself and what is realistic. Don't just look at what's trending there. And sometimes the best guidance isn't just a new trend. It's about reconnecting with an instinct we're all born with, and we often forget to trust our natural hunger signals. So one of the most practical tools I use with clients is this hunger scale that you see on the right. It helps you tell the difference between physical hunger, so your body needing fuel, or emotional or habitual cravings, meaning your body is craving, it's wanting something for comfort or distraction. So here is how the scale works. 1, as you can see there in red, is starving, dizzy, hangry, irritable, and 10 is overfull, uncomfortable, or bloated. I like to call this the matching game. If you start a meal and you're feeling at a 1, you will more often than not eat until you're at a number 10, where you're so stuffed you feel really sick. Before you do anything, take some time throughout the day. Don't change anything. Just record. Think about at different times in the day, record where you are on this scale. And once you understand that, you start to learn about what it feels like or what are some signs that you have at the different numbers on the hunger scale. The ideal window or the ideal number on the scale is to start eating when you're at a 3 or 4. So when you're gently hungry, you're starting to feel a little bit hungrier. And when you start a meal at that point, you will naturally stop and feel satisfied. Again, this takes practice because you may have not been doing this for a while. You'll naturally stop at a 5 or a 6, and that's when you're comfortably satisfied. You're not stuffed. You're not, um, trying to eat more. This is about reconnecting with how you feel. So I can't really tell you what 1 will feel like versus 5. And that's why I say take some time to just, before you even change anything, just take some time and look every hour of your waking day, your eating day, where you are. Notice what it's like before you start a meal and then after you start a meal. And then you can start pacing yourself. I often see that most people need to consume or have an eating opportunity within anywhere from a 3 to 5 hour time frame, but it really depends on the person. It depends on how they're doing. So the reason I'm bringing this up is because mindful eating and listening to your hunger will help reduce overeating, and that will help your liver manage blood sugars, fat storage, and detoxification at a reasonable rate. It also will help you start to understand why you're eating, and you'll be choosing to eat to fuel your body and enjoy the food rather than out of boredom. So when it is time to eat, one of the most powerful things you can do to your health and your liver is build a balanced, satisfying plate. A balanced plate, or I like to say the proportions, is half your plate with non-starchy vegetables and fruit, 1/4 with grains or starchy vegetables, and 1/4 with protein source. This creates a powerful combo of carbohydrates, protein, and healthy fats, which will help you stay energized, feel full longer, and have a more nutritionally balanced diet. This is not about dieting. The Mediterranean eating style is about food and enjoyment, and yes, proportions and looking at your plate, but also checking in with your hunger, planning, your meals so that you know how much food you're going to consume or that you need. So every plate that you put in front of you is an opportunity to nourish your body and support your liver. Finding the right snack mix to fuel your body is key. A lot of people tell me that they don't snack. Snacking, leads to weight gain. That's not true. I think it's important to check in with your hunger, and sometimes between lunch and dinner, it may be 6 hours. So you want to prevent arriving at dinner time and feeling really hungry, and then overeating your dinner meal. So a power snack will really be helpful to fuel your body. So my formula is the C plus P plus F, the carbohydrates, the protein, and the fat. Carbohydrates from whole fruits, vegetables, whole grains will give you sustained energy without overloading your liver. You bring in the proteins from foods like nuts, seeds, yogurt, or lean meats, and that'll help you feel full and satisfied and take a little bit longer to digest. Healthy fats like those in avocado, olive oil, nuts will help your body absorb the fat-soluble vitamins like A, D, E, and K. So when you put them together, all three, it slows down the amount of sugar that's going into the bloodstream and therefore the amount of insulin that is reduced. So it is important to strategically plan power snacks between meals to maintain a stable blood sugar level and support healthy metabolism. Power snacks don't have to be complicated, just aim for a balanced trio, and sometimes it could be just a power bar or a protein snack. You need to enjoy what you eat and feel good about the way you nourish your body. Another question that I often get is, should I be taking probiotics, especially from clients who are focused on their gut and liver health? So let's take a few minutes, just talk about what probiotics are. They are the live, beneficial, good gut bacteria living in your gut microbiome. So what we talked about earlier. However, probiotic pills are like ones that have been studied and then dried or live cultures in supplements that you can actually take in to supplement your gut microbiome. You'll also find some of them in fermented foods like yogurt with live cultures, kefir, kimchi, sauerkraut, and tempeh, miso, and kombucha. So why does this matter? Well, we talked about earlier, your healthy gut microbiome is directly connected to a healthy liver. So, when your microbiome is in balance, it'll help with digestion, reducing inflammation, and protecting your liver from harmful stress. Do you need to take probiotics? Really, it depends. Did you just have a gut virus? Did you just have, were you just on antibiotics? Are you showing signs of, dysbiosis? Those are some of the questions that I ask my clients before I suggest a probiotic. And not all, there are trillions of probiotic strains, and then there are hundreds of, I don't know, thousands of probiotic products on the market. So it is important to understand which probiotic strain has been studied together with MASLD or liver fat and inflammation. So I want to talk about some foods that can interfere with a healthy dopamine levels. So we talked about dopamine as that happy chemical that's and helps with motivation, feeling full. But sugary foods and drinks like sodas, candy, and cake initially will flood your brain with dopamine, but it eventually reduces your system's sensitivity over time. I talked about earlier how ultra processed foods like fast food, chips, packaged snacks, They contain artificial ingredients or they're designed in a way to disrupt the brain's natural reward system on how it uses dopamine. Fried foods, processed meats, high in saturated fat impair the dopamine system's effectiveness and increases the risk of food addiction. Skipping meals and erratic eating schedules can destabilize the regulation of dopamine. Chronic stress depletes dopamine reserves and interferes with healthy dopamine balance in the brain. So it's, again, back to moderation and choices. I'm not saying never. I'm just asking, people to just be more selective of when they choose any of the foods on this list. Another common question I get is what supplements should I take for my liver? And before we jump into pills, we're going to talk about nutraceuticals, so nutrients that are naturally found in food, but now we find them in supplements, and which ones have been associated with supporting liver health and reducing or reversing liver fibrosis. So one, vitamin C, shown here in orange, is a powerful antioxidant that helps reduce inflammation and oxidative stress, both of which will contribute to liver scarring. So you can get vitamin C from citrus fruits, bell peppers, leafy greens. It's really important to reduce that inflammation. Number two, omega-3 fatty acids, represented by salmon and some healthy oils, are well-researched anti-inflammatory oils. They help reduce liver fat and slow the progression of fibrosis, especially in people with MASLD. Good sources include fatty fish like salmon, flax seeds, walnuts, or omega-3 enriched eggs. Often, when I'm doing a diet history, people will tell me they don't love fish, and that's okay. I'm not going to force fish down your throat, but it's important to see that you're getting omega-3 fatty acids from other sources, or supplementation will be helpful in this case. The third that we see here is carotenoids, which are found in orange, red, and yellow vegetables like tomatoes, carrots, and sweet potatoes. These are also antioxidants that calm liver inflammation. And while the research is still early, it's potentially promising. Then there's curcumin, the active compound in turmeric. It's shown here as a root and a powder. It has been shown to block liver fibrosis pathways and reduce, again, the oxidative stress. It's still being studied in the lab. It's gaining attention for being anti-inflammatory. But again, I would rather you focus on foods than on supplements. All of these nutrients are best consumed and used through whole foods and not isolated pills because when you're consuming them, we know they're safe, they're affordable, and part of a healthy Mediterranean diet supporting your liver. So supplementation does have a role when you cannot get the nutrients that you need from a regular diet. And that is something that could be discussed with your doctor or with with a dietitian, and they can help you understand. Next, let's talk about medications, specifically new weight loss medications that are showing real promise for people with liver disease. These medications aren't just about the number on the scale. They've been shown to provide direct liver health benefits, especially for people with MASLD or MASH. Research has shown that these medications can slow the disease progression, lower liver enzyme levels, and reduce liver fat content. And these improvements have been seen in both liver scans and blood work. So the clinical results are impressive, especially when these medications are used as a broader part of a treatment plan, including lifestyle changes like diet, movement, and gut health support. And in many cases, a combination approach, medication plus nutrition therapy, provides even greater benefits than either one alone. So while medication isn't for everyone, for the right person, it could be a valuable tool in protecting liver health and preventing long-term liver damage. All right. I can't be a gut health dietitian without bringing up the Bristol stool chart. So you don't need to obsessively check the toilet bowl, but I would like you to be aware because your stool is one of the clearest indicators of what's going on in your gut. The Bristol stool chart is a medical tool that classifies your stool, your bowel movements, into 7 types. Type 1 and 2 are hard, lumpy, and difficult to pass. They often signal constipation or slower digestion. Type 3 and 4, these are the ideal stool consistencies, soft, sausage shaped, and easy to pass, reflecting healthy digestion and good fiber and hydration levels. Types 5 to 7 are looser or watery and may indicate inflammation, gut irritation, or rapid transit time. So by simply noticing your stool type, you can either gather useful insights about your hydration status, your fiber intake, your microbiome, and your overall digestive health. It's a great self-check-in tool to help you know when your gut might need support and when things are just not flowing right. When I see people who describe it as sometimes I'm a 1, then I'm a 4, and then I'm a 7, all within a week that they're constantly fluctuating, that is also a sign of constipation. So both things can be true. You can be having a bowel movement and you can be constipated. So the idea here is to look at it and say, okay, am I normally in the type 3 and 4 stage? And is that like my normal? But if I'm fluctuating throughout the week and I'm suffering from gas and bloating and just not feeling great a few times during the week, or like these explosive bowel movements, then that requires a conversation with your doctor or your dietitian to see maybe there are some changes in your diet that we can do to help ensure that you go back to regular flowing type 3, 4 bowel movements. Now that we've explored diet, movement, and medical options, let's talk about what it takes to maintain progress, because the journey doesn't end at the prescription pad. First, we need to remember weight loss medications are a tool, not a cure. They can help jumpstart change and create momentum, but long-term success depends on what happens next. Second, it's important to understand how the body naturally will respond to weight loss. So the biology is designed to protect us from weight loss. So when we start losing weight, we can either feel an increase in hunger or slower metabolism. That's not about willpower. It's how our body is designed and wired for survival. That's why long-term habits are essential. Meal planning, consistent movement, sleep, and stress management are key. And these everyday behaviors can help turn short-term wins into sustainable health improvements. And lastly, no one should have to do this alone. Real progress is best maintained with the support from a whole care team that includes nutrition experts, medical providers, mental health professionals, and social supports. When we talk about making lasting lifestyle changes, it's important to be honest here. So progress is rarely a straight line. This chart is one that I find beautifully illustrates the reality. There are going to be highs and lows, wins and setbacks, and that's all part of the journey. Relapses and plateaus are normal. They're not a sign of failure. They're moments of learning. Instead of seeing setbacks as personal shortcomings, we can view them as chances to reflect and reassess and grow. Progress takes trial and error and often looks more like a zigzag than a staircase. And that's especially true for people living with MASLD. Life will always throw curveballs at you: stress, illness, travel, routines shifting. And those moments never mean that you're failing, they're just part of the process. So the key here is that change is possible, but it's not going to be a smooth line. It's going to require a team and for you to be resilient and follow a path forward to long-term health and self-care. At this point, I usually share with some clients 2 self-help book recommendations that can help them on health behavior change in between the visits that I'm working with them, or for people that can't have many visits with me. So the first one on the left is called Healthy Habits Suck by Dr. Dana Lee Bagley, who's a Canadian psychologist. And I find that really a great book that's using science-backed strategies and humor to help you build habits that stick when your motivation is really low. Nobody runs for the asparagus if there's French fries in the container. I mean, it's very rare. The second book is The Happiness Trap by Dr. Russ Harris, a psychologist and medical doctor in Australia. He introduces acceptance and commitment therapy, ACT, as a tool for navigating the emotional side of behavior change. So both books use ACT, and it teaches you how to stop getting stuck in negative self-talk and how to work through resistance and take meaningful action even when it is hard. So I encourage you to look these up because I think they can help you, or find a health professional that can help you through this process. As we wrap up, I want to leave you with 4 key takeaways from today's session. 1, MASLD and fatty liver go beyond weight and alcohol. So as you heard me say, it's complex. It's a chronic condition rooted in a metabolic dysfunction, not just your body size or excess alcohol intake. It affects people across the weight spectrum, and it's shaped by factors like genetics, lifestyle, muscle mass, and gut health. 2, early detection is key. MASLD can silently progress to more serious conditions like liver fibrosis or cirrhosis. And the earlier it's identified, the more you can do to reverse or manage it. 3, the brain, liver, and gut are all interconnected. What impacts one system often affects the other. So that's why addressing MASLD effectively means looking at the whole person, from microbiome to mental health. 4, what you eat matters, but so does how you eat. Balanced nutrition, consistent meal timing, fiber, mindful eating, and enjoying your foods are all part of a sustainable liver supportive approach. The big picture here is that MASLD isn't just a liver issue, it's a metabolic lifestyle and whole body issue. And that means there are many entry points for healing. And with the right tools, guidance, and support, we can help people not just manage this condition, but actually feel better, live better, and protect their long-term health. Before we wrap up for our questions, I want to leave you with a few trusted resources you can explore after today's session. If you're in Ontario, you can use this link to access the FIB4 screening tool, which is a simple blood test that helps assess liver fibrosis risk. You can also find information and education about liver health through Liver Canada, Fatty Liver Alliance, and CAN MASLD. And don't forget the Canadian Digestive Health Foundation's discussion series. There's webinars on the website, as well as many blog articles that will be extremely helpful to continue your learning and help you with the next steps in your health journey. Thank you so much for joining me today. We've covered a lot, from understanding MASLD and the liver's role in the body to exploring how food, movement, gut health, and even mindset are all coming together to support long-term health. My hope is that you're walking away not with just information, but with inspiration and some practical tools you can use, whether for yourself, your family, or the people you care for. Remember, progress doesn't have to be perfect and change isn't always linear, but with the right support, a personalized approach, and a little self-compassion, healing is possible, and reversing MASLD in the first 2 stages is really important. Feel free to explore the resources, and if you have any questions or want to continue the conversation, I would love to connect. Take care, and thank you again for being part of this important discussion. Here are some references that you can access, and thank you again.